hear more Show-Me cards. We're going to hear more. And we're going to...
Tom, you brought a lot of the whistleblowing motions to various BMA meetings. Why has that been?
I originally started with that motion because a friend of mine was involved in a case at a hospital that he was training at where he was very concerned about the quality of care that was being delivered in the hospital, and he tried to raise those concerns and ended up having quite a lot of problems because of it, and he met lots of obstructions and started being given funny looks in corridors and people staring at him and being taken aside for chats and that kind of thing. And he was finding it very difficult, firstly, to get his concerns addressed, and secondly, to stop this low-level harassment from happening. So when we tried to get other people involved to support him, we found that it wasn't very clear to us how we should go about doing that, and so the Junior Doctors Committee decided that we needed some sort of more guidance for people in that situation so that they wouldn't find themselves stuck without knowing who to go to get things sorted out.
We know now obviously about the Staffordshire example. Do you think that these examples are very common?
There's no way of knowing how common it is for practice to be taking place without it being declared, because obviously by definition you don't know about it. I would think that there are probably a fair number of cases where people have seen substandard practice happening, because obviously there's a spectrum of practice in the NHS, and it's almost a statistical certainty that there'll be other cases out there where people know of things that are happening but are either afraid to say something or have said something and been stymied by people who are either don't recognise that the practice that's going on is substandard and they think that it's all okay and this person is just talking nonsense, or else they feel threatened by it and that's why they respond to it negatively and try and squash the complaint.
And Dr Mowat, what's been your experience of whistleblowing?
Well, I think as Tom said, I have a number of colleagues who've reported to me experience of seeing substandard practice in their workplace. It's very difficult to quantify, but I myself have some experience years ago of reporting concerns about the out-of-hours care of my patients, and first of all being uncertain about how to go about that, and secondly, when I did go about that, being met by a very aggressive response which sadly involved the threat of action taken against me. Now, thankfully, that action wasn't taken and wasn't necessary, so I was able to report those concerns in a positive way and indeed help the Primary Care Trust move on with its care of out-of-hours patients.
Do you think that the government understands quite how destructive the whole whistleblowing attitude of employers can be, and are the BMA fighting it vociferously enough?
I think the government are certainly aware that this is quite a destructive thing that's taking place, and I think so with the last government as well. They brought in the Public Interest Disclosure Act, and this government obviously has moved that forward, and that's a good thing. As for what the BMA is doing, of course we produce the guidance, and any time that a doctor is concerned that they want to raise these issues but they feel threatened by it, they can of course come to the BMA. We'll support them with that, and we've been strongly doing so in several cases recently.
Much is reported about the process that doctors are expected to go through in order to not break their contracts, so-called gagging clauses. Does that all need to be changed? Is that something that you have experienced has been problematic?
At the last trust that I worked at, the HR department asked me to sign a confidentiality agreement, and I was reading through it, and it suddenly occurred to me, of course, because of having been involved with this whistleblowing guidance, it occurred to me to wonder whether I would be allowed to break it if I felt there was a need to raise issues. So I asked the HR person that was there if I was sitting writing on my first day, and I said, "Excuse me, do you have a whistleblowing policy?" And this unnerved her immensely, and she had to get the manager over to come and ask me why I wanted to know about the whistleblowing policy. It was quite defensive, but yes, we do have a whistleblowing policy. So I happily signed the agreement. I think it's important to recognise that the legislation does protect people who make these disclosures in good faith and with good reasonable expectation that this is the only way of going about it. We've always been, the BMA guidance and other guidance is always very clear. You should try and start at the lowest level you can, i.e. telling your immediate boss that this is the problem, or taking it to within the department, before going to the next level and then to the chief executive and then beyond to the regulator or the media.
And yet some doctors still feel that the most powerful way of getting their concerns out there might be to go to the media. Are you at all sympathetic of that?
I think in an individual setting it's often very frustrating to be the person who raises concerns, and I can understand how doctors are led to that almost as an act of last resort because they feel their concerns are not being listened to. But I always think it's better to be discussing the principles of the policy rather than the individual cases, because appearing in the media can never consider the pros and the cons of an argument, and so we often get reported in the media the superficial facts of a case, but not perhaps the deeper facts. So I think the BMA's role in this is very much to stand up for doctors who are whistleblowers, to give them advice on the best way of approaching it, and as you quite rightly said, that's step by step, starting with local reporting and hoping that in doing so their concerns are answered. But the BMA's job is to stand up for doctors, and we do that very firmly.
Andrew Mowatt and Tom Dolphin, thank you very much for your time.